Hey guys, my name is Russell Linville. Thanks for tuning in. This is 2 Cent Tuesday, and this is part of the Become a Better Human project. And so we're talking about today, Tuesdays we talk about things that might, I've heard in the clinic or I've thought about, over time, things that might be a little controversial or maybe think twice about it. And so today, I want to talk about rehab protocols. So in the past, I've heard someone, another provider, when I was working in another practice, was talking about they don't like to follow rehab protocols. And that really got me thinking, because I'm a big, specific, hey, this rehab protocol is in place for a reason, and we're going to follow and we're going to do the exercises on that, and we're not going to stray too far from it. And so at the time this guy told me about it, I was like, no way. I'm pretty conservative. I'm not going to, put excess stress through tissues and that sort of thing. And the more I got to thinking about it and talking to this guy, what he means by he doesn't follow protocols is he doesn't follow them to the T. Right? Protocols are in place as a guideline to help the clinician or the provider protect the patient during whatever stage of healing that they're currently in. But that doesn't mean that you can't do other things to make them feel better and move better, as long as the forefront of your mind, you're protecting, maybe it's the surgical repair, or you're loading in an appropriate way if you're dealing with a tendinous or a muscle injury, or you're not cranking the joint into excessive range of motion. And you're thinking about what position that the patient's in, and how does that stress the area that they've been injured. So rehab protocols, I think the stance that you don't follow it, that statement in isolation, is probably the wrong approach. You need to have a guideline, and the more experience you get, you'll start to develop these guidelines almost innately on what a patient needs. If you're a new grad, I really think you should dive a little deeper in those protocols, read them multiple times, review them every time a patient comes in, so you get a sense of what you're trying to protect, especially in a post-operative patient. So my challenge to you is, next time you see a patient, review the case, see what they are allowed to do based on the rehab protocol, and then I want you to try to read between the lines a little bit. If they're an athlete, you can get them up and moving if they have a shoulder injury, right? If they're in a sling and you feel like they can protect it and their pain's low and they're not, in any acute distress, have them do a little bit of a dynamic warm-up with their lower body. They can do standing lunges, they can do squats, they can do what we call Cossack squats, right? Some lateral lunges, you can do calf raises, all these things to help them feel like an athlete again, instead of just being on the table and we're just taking their arm through range of motion. Yes, we need to do that, but I think getting them in a mindset that they are healing and feeling better and they're starting to move again helps them regain the sense of purpose. And we know when someone gets injured, there's a lot of yellow flags that happen, right? They go through the 5 stages of grief. And so we want to make sure that they're not falling or spinning into this position where they're losing hope, because now they're injured, they're not with their teammates anymore, they're not back at work anymore, they're not able to pick up their grandkids anymore, so on and so forth. So this all ties back to the rehab protocols. Use them, protect your patient. Read between the lines a little bit, careful with it, but read between the lines, get them up and moving, give them a sense of purpose again. That's probably your biggest job as a physical therapist, is to gain some independence in your patient population. Don't just disregard the protocols, but I think it's okay to, again, read between the lines so that we can make sure this patient feels like they're improving. So this is 2 Cent Tuesday. Thanks for tuning in, and subscribe below if you like these videos. Thanks.